Hi, today I'm going to be talking about becoming a certified nursing assistant in the state of Minnesota. The parts I will be talking about in my speech are the requirements to become a CNA in the state of Minnesota, what a CNA is and does, and the wages that go along with it. I chose this topic because for the past year this has been my occupation at a local nursing home. According to the website nursesgroup.com, a certified nursing assistant in Minnesota needs to complete a few things. First, you have to register for classes. Usually your local community college has a few. Once you are registered for classes of the state of Minnesota, you have to complete 8 to 13 weeks of course time. I had this book when I was in class. And basically enough to gain 75 hours of accredited coursework. Then you have to complete 100 hours of clinicals. After you've completed course hours and clinicals, you have to take and pass 2 exams, one written and one hands-on test. The written exam contains 50 to 60 questions, anywhere from common sense, feeding, general cares, and home health aid questions. Then the hand-on exam has you doing cares such as brushing teeth, putting on TED hose, feeding, and bed baths, and etc. other cares that you would do. And as you do these cares, you have to say in the correct order what you're doing and how you would properly do it. If you happen to fail either one of the classes or either one of the exams, or you fail to finish your course hours, you have to retake the class. The only other way you have to retake the class is if you fail to use your license within a 2-year period. Now onto what a certified nursing assistant is and does. According to Monster.com, the duties of a certified nursing assistant include, but are not limited to, the following. They provide normal daily care such as shaving, bathing, and showers, assistance in the bathroom, and giving patients bedpans and urinals when they're unable to get out of bed. Other daily activities they assist with are serving meals and feeding patients, providing fresh water and or foods during or between meals. CNAs also help with ambulating or walking and turning and positioning a patient when they are uncomfortable. These are the normal daily activities of a CNA, but there are some other things such as applying ice packs, applying non-sterile dressings, helping with surgical preparations, giving heat treatments, and therapeutic baths. CNAs also have to check vital signs, which are blood pressure, temperature, pulse, and respiration rates, usually before the bath or shower, and if a fall happens. CNAs also check weights daily to make sure that the residents are maintaining a healthy weight. They also record input and output information on a patient. Some other small things a certified nursing assistant does are answering call-outs and the requests that come along with them, reporting observations to the head nurse, and they document actions and changes in behavior. In short, a CNA is a multitasking, caring, and patient person. Moving on to the salary. Now, according to the website salary.com, the wages of a CNA can vary from place to place. The cities I researched in Minnesota are Duluth, Rochester, Eden Prairie, and Minneapolis. In Duluth, 50% of the annual salary of a CNA is $24,800 and an hourly rate of $12. In Eden Prairie, 50% of CNAs made the annual amount of $27,000 and an hourly rate of $13. In Minneapolis, the 50% of CNAs made an annual amount of $27,000 and they also made $13 an hour. And lastly, in Rochester, 50% of CNAs made an annual amount of $24,000 and an hourly rate of $12. Even though the salary differs slightly from city to city, the benefits of a nursing assistant pretty much stayed consistent. They all got the bonus time off, health care, pension, disability, 401k, and Social Security. Though, again, the numbers differ from place to place. Now that you have learned what it takes to become a CNA in the state of Minnesota, the duties that they perform each day, and the wages that they can get, depending on the place that they work, doing this job takes a lot of hard work and patience, but it is 100% worth it at the end of the day. I hope you enjoyed my informative speech on being a certified nursing assistant. Goodbye. Have a nice day.